It's a very, very tough question, and it's a very tough thing. I'm very sorry to hear about your mother. That's hard. And ovarian cancer in general is a tough one. It's one that we all worry about, and the biggest thing about it is we don't have a good screening test for ovarian cancer. I think the best thing you can do is get a yearly pelvic exam by an OBGYN or an obstetrician gynecologist such as myself. I think that helps. There are some times with strong family histories that I recommend getting an ultrasound of the pelvis, but again, it's not considered a good screening test. There are also some labs out there that you can have drawn, but again, not very good screening tests. So when it comes to ovarian cancer, it's difficult, and I think the best thing you can do is see an obstetrician gynecologist such as myself for just a yearly exam, and we can talk about some of these other options that are available. The symptoms of ovarian cancer are also difficult, and that's why it's such a hard thing to diagnose, is because oftentimes by the time it's caught, it can be a little bit too late. Some of the symptoms, though, are getting full very fast when you eat. Some people do have some abdominal or pelvic pain. Some people have intestinal complaints such as diarrhea or constipation or funny looking stools, or feel like they have a lot of abdominal bloating. But in general, these symptoms are very common with just normal day-to-day life, that it is very difficult to tell. Ovarian cancer is a hard one, and we haven't yet developed a good screening test for it. They are developing new genetic screening tests that are becoming available, and if you have a strong family history of ovarian cancer, there are some genetic tests that can be done. Those tests aren't necessarily right for everyone, but for people with a strong family history, and that can be evaluated when you talk to your provider, it can be a good thing. In general, I think the best thing you can do is get an annual exam by a physician.